Let's talk about the CDC's latest VAERS analysis. Hello, I am Dr. K. Paul Stoller, and this video is about the CDC once again trying to pull the wool or COVID jab over our eyes. What they are trying to pass off as science is actually be a masterclass in misdirection. Now, I know you're sharp, you question things, you check the sources. So let's peel back the layers together. VAERS, the Vaccine Adverse Event Reporting System, is basically the government's own tool for tracking vaccine side effects. As of May 2025, it's recorded nearly 19,500 deaths after COVID-19 vaccination. To put that in perspective, before COVID, the average was about 400 deaths per year for all vaccines combined. That's not just a blip, that's a blaring siren. But here's where it gets interesting. The CDC took those reports and immediately tossed out over 5,000 of them. Why? Some had missing info, others weren't mRNA vaccines, and get this, some were labeled not real deaths. But how are we supposed to trust those criteria when they're not even transparent about the process? So we're left with about 12,800 reports, still a lot. But instead of comparing these post-vaccine deaths to unvaccinated people, the real scientific approach, they compared them to these fuzzy background death rates during the pandemic. That's like measuring a fever against the average temperature in a heat wave and saying, see, totally normal. Here's the problem. There was no control group, no rigorous head-to-head between vaccinated and unvaccinated, and no systematic autopsies to truly investigate the causes of death. So any talk of nothing to see here just doesn't hold up under scrutiny. And let's not forget, VAERS is notorious for underreporting. A government-commissioned Harvard study found that fewer than 1% of adverse events actually get reported. Even if it's just 10% for deaths, we could be looking at numbers 10 times higher than what's on paper. But here's the kicker. The CDC always says VAERS can't prove causation. Yet now they're using it to claim no link without even doing the basic scientific checks. If the system isn't reliable enough to confirm harm, it can't be reliable enough to declare safety either. This isn't just data. Real people, real families are grieving sudden, unexplained losses. Some doctors say they've been threatened for reporting these cases at all. This isn't the transparency or accountability we deserve. This is narrative control, plain and simple. So don't let anyone tell you this is rigorous science. It's statistical sleight of hand. And if you care about truth, about real public health, you should demand better. Stay curious, stay skeptical, and always, always follow the evidence wherever it leads,